Case management is not one single job. A hospital case manager, an insurance case manager, a community-based case manager, and a utilization review nurse can all work in case management spaces, but their day-to-day roles may feel completely different. So before you decide if case management is right for you, it helps to ask a better question. Which type of case management is right for the way you want to work? Because this is where many nurses get stuck. They know they want something beyond the bedside, but they are not sure which direction to go. They see job titles like case manager, care coordinator, utilization review nurse, transitions of care nurse, remote case manager, or population health nurse, and it all starts to blur together. But those roles are not all the same, and choosing the wrong setting can make a nurse think, maybe case management is not for me, when really, that specific version of the role may not have been the right fit. So let's walk through how to think about your options in a practical way. The first question is, how close do you want to stay to the hospital environment? If you still like being near the clinical team, hospital case management may be worth exploring. Hospital case managers often work with providers, bedside nurses, social workers, therapy, families, facilities, home health agencies, and insurance companies. The work is usually fast-paced and heavily focused on discharge planning, transitions of care, barriers, and safe next steps. This can be a good fit for nurses who want to move away from direct bedside care, but still want to feel connected to the hospital setting and the clinical flow of patient care. But if you are trying to get away from the pace of the hospital completely, that is important to recognize. Hospital case management can still involve urgency, interruptions, difficult discharges, and pressure around timing. The second question is, how much patient contact do you want? Some nurses want to keep talking with patients and families. They enjoy education, coaching, listening, and helping people understand the next step. If that sounds like you may prefer case management roles that include patient outreach, care planning, transitions of care, chronic disease management, or community-based support. Community-based case management can be a strong fit for nurses who care about what happens after the hospital. These roles often focus on helping patients manage health in real life, with real barriers like transportation, medication access, caregiver support, food insecurity, housing concerns, or follow-up care. The pace may be less hospital-driven, but the needs can be complex. You may be supporting patients over time instead of solving everything in one shift or one admission. For some nurses, that feels meaningful. For others, it may feel slow or emotionally heavy if resources are limited. The third question is, do you prefer communication-heavy work or review-heavy work? This is where utilization review comes in. Utilization review nurses often spend more time reviewing charts, applying criteria, looking at medical necessity, reviewing authorizations, and determining whether the documentation supports a service, admission, continued stay, or level of care. That role can be a good fit for nurses who like clinical reasoning, documentation, guidelines, and more behind-the-scenes work. But it may not be the best fit for a nurse who wants a lot of patient education, family conversations, or care coordination. That does not make one role better than the other. It just means they use different strengths. The fourth question is, are you interested in remote work because of the role, or only because it is remote? This is important. Remote work can be appealing, especially for nurses leaving physically demanding bedside roles, but remote case management still comes with structure, documentation, phone calls, productivity expectations, software systems, and sometimes very repetitive workflows. Remote tells you where the work happens. It does not tell you what the work actually is. A remote role could be patient outreach. It could be utilization review. It could be prior authorization. It could be transitions of care. It could be disease management. So before applying, look past the word remote and read the responsibilities closely. The fifth question is, what kind of problems do you actually enjoy solving? If you like fast-moving discharge puzzles, hospital case management may interest you. If you like helping patients understand their care and stay stable over time, community-based case management may fit. If you like benefits, authorizations, care coordination, and helping members navigate the payer side of healthcare, insurance case management may be worth exploring. If you like reviewing charts, applying criteria, and understanding medical necessity, utilization review may be a better match. And if you like structure, independence, technology, and communicating from a distance, a remote case management role may be a good option, depending on the responsibilities. This is why job descriptions matter so much. Do not only look at the title. Look for the words that describe the work. Words like discharge planning, interdisciplinary rounds, length of stay, skilled nursing, rehab, home health, and durable medical equipment usually point toward hospital case management. Words like member outreach, benefits, care plan, disease management, payer, authorization, and provider communication may point toward insurance case management. Words like social determinants of health, community resources, chronic disease management, patient engagement, outreach, and barriers to care may point toward community-based case management. Words like medical necessity, clinical criteria, concurrent review, continued stay, level of care, denials, and appeals usually point toward utilization review. Those words are clues. They help you understand what the job may actually feel like once you are in it. It also helps to ask better questions in interviews. You can ask, what does a typical day look like in this role? How much of the role is patient communication versus chart review? What population would I be working with? How is success measured? What training is provided for nurses new to case management? What are the biggest challenges someone should expect in this position? Those questions can tell you much more than the title alone. Now, if you are coming from the bedside, remember this. You do not need to know every case management term before you start exploring, but you do need to learn how to connect your nursing experience to the role you want. If you are applying for hospital case management, talk about discharge needs, interdisciplinary communication, patient education, safety concerns, and transitions of care. If you are applying for insurance case management, talk about care coordination, patient education, chronic conditions, barriers to care, documentation, and helping patients understand the plan. If you are applying for utilization review, talk about clinical judgment, chart review, acuity, documentation, guidelines, and your ability to understand why a patient needs a certain level of care. The goal is not to pretend you have done the exact job before. The goal is to show how your nursing experience connects to the work. The biggest takeaway is this. Case management can be a meaningful path beyond the bedside, but the setting matters. The pace matters, the patient population matters, the amount of phone work matters, the amount of documentation matters, the balance between coordination and review matters. So do not just ask, should I become a case manager? Ask, which case management path fits how I want to use my nursing skills? That question will help you make a clearer, more confident decision. And if case management is the path you are curious about, we have a place for you to start. To better understand case management beyond the bedside, click the link below and visit the CMI landing page. You can start learning what case management is, how the role works, and how your nursing experience can translate into this next chapter of your career. Because your nursing career does not have to end at the bedside. It can grow from there.